Hello friends, welcome to my YouTube channel. Today we are going to discuss about a very important topic, that is sexually transmitted diseases or infections. So let us look at the first one, that is condyloma acuminata. Condyloma acuminata, it means pointed warts, and it's also known as genital warts. It is caused by HPV virus, human papilloma virus. Human papilloma virus, there are low risk viruses and high risk viruses, and the condyloma acuminata is caused by low risk human papilloma virus, that is 6 and 11 variants. The patient presents with asymptomatic fleshy pink pointed masses on coronal sulcus and frenulum in males and posterior faucet in females. See, on coronal sulcus you see asymptomatic fleshy pointed mass, and on posterior faucet you will see these type of masses. And there is one more variant of condyloma acuminata, that is called as giant condyloma. This is how it looks like. Giant condyloma looks like this. Let us now come to the treatment part of the condyloma acuminata. If the patient is non-pregnant, the treatment is given using podophyllin resin, 25% podophyllin resin, and you can also give imiquimod. If the patient is pregnant, the treatment of choice is cryotherapy using liquid nitrogen, or you can also try trichloroacetic acid. And in giant condyloma, surgery is the treatment option. This is about condyloma acuminata, and now let us look at one more condition, that is urethritis. Urethritis in clinical forms are of two types, gonococcal and non-gonococcal. Gonococcal urethritis is caused by gonorrhea, while non-gonococcal is caused by chlamydia trachomatis, ureaplasma urealyticum, mycoplasma genitalium, trichomonas vaginalis. And gonococcal urethritis presents with profuse purulent discharge, fever and other constitutional symptoms, and severe dysuria, while non-gonococcal urethritis presents with scanty mucoid discharge, and there will not be fever and dysuria. If you take sample and put it and stain it with gram stain, you will see gram negative intracellular bacteria in gonococcal urethritis, and the investigation of choice in non-gonococcal urethritis is NAT, nucleic acid amplification test, on urethral swab or on first wide urine. You can culture gonococca in modified Thermotin medium, and the treatment in gonococcal urethritis is injection ceftriaxone 250 mg IM plus azithromycin 1 gram. In non-gonococcal variety, we give azithromycin 1 gram or doxycycline 100 mg BD for 7 days. Yes, this is how gonococci look like on gram stain. These are gram negative intracellular bacilli. These are gram negative intracellular cocci. Now let us come to one more topic, that is vaginitis. There are three conditions which presents with vaginitis: vaginal candidiasis, bacterial vaginosis, trichomoniasis. Candidiasis is caused by Candida albicans and non-albicans species. Candida is a dimorphic fungi, and it presents as curdy white discharge and out of proportion of pruritus. On examination, you will see plaques on vaginal walls. On removal, you will see petechiae. But bacterial vaginosis presents with creamy discharge, and there will be no pruritus, and there will be fishy odor, clue cells, and whiff test is present. Whiff test is positive, means there is fishy odor on addition of 10% KOH to the discharge. While trichomoniasis presents with greenish yellow frothy discharge, and there will be severe pruritus, and you will see colpitis macularis, that is strawberry vagina. Investigation of choice in case of candidiasis is saline microscopy, and gold standard for diagnosis is SBA medium. And investigation of choice in trichomoniasis is saline microscopy, and gold standard is diamond medium or Feinberg-Whittington medium. The treatment of candidiasis includes, you can prescribe the patient with azole cream or oral fluconazole 150 mg stat. In candidiasis, you have to treat both the partners, male and female. In bacterial vaginosis, treatment includes giving the patient metronidazole 500 mg BD for 5 days. Here you have to treat female only, because there will be no sexual transmission. In trichomoniasis, treatment includes metronidazole, and you have to treat both male and female. Let us now look at some pictures of these conditions. So before going to that, let us discuss about Amsel's criteria. Amsel's criteria is used to diagnose bacterial vaginosis. There are 4 criteria. First one is homogeneous adherent white discharge, vaginal discharge pH more than 4.5, and whiff test positive, that is fish odor on addition of KOH to the vaginal discharge, and you will see clue cells with stippled border more than 20%. So let us now look at these pictures. This is how vaginal candidiasis presents with. There will be curling white discharge and white plaques adherent to the mucosa, and on pap smear you will see shish kebab appearance because of the hypase, and these vaginal epithelial cells adherent to the hypase and give appearance like shish kebab appearance. And these are the clue cells. These are vaginal epithelial cells embedded with bacteria Gardnerella vaginalis, and these are the pictures of trichomoniasis. You will see greenish frothy discharge, strawberry cervix, and on pap smear you will see pear shaped cells, and this is how the trichomoniasis vaginalis looks like. This has 4 flagellas and 1 undulating membrane. These pictures are very, very important, and they may come as image based questions. And there is a syndromic management by NACO, and the kit we are using here in case of vaginal discharge is kit 2, that is green color kit, which has secnidazole 1 gram BD dose plus fluconazole 150 mg single dose for vaginal discharge syndrome. Here you can give secnidazole 2 gram stat also. Okay, now let us discuss some questions on these topics. 35-year-old woman presents to the general practitioner with offensive vaginal discharge. The discharge is associated with dysuria and vulval itching. What is the diagnosis? Yes. Let us look at the options. Candidiasis, bacterial vaginosis, leukorrhea, and trichomonas vaginalis. Well, in you will see itching in candidiasis and trichomonas vaginalis. You don't see itching in bacterial vaginosis and leukorrhea. Leukorrhea is physiological condition. It is ruled out, and bacterial vaginosis you won't see pruritus or itching. That's why it is ruled out. So we are left with option 1 and 4, and the dysuria. Dysuria is prominent in case of trichomonas vaginalis, and so we are going with the option trichomonas vaginalis, option 4. That is the answer over here. And one more question. A 25-year-old woman presents with complaint of vaginal discharge. A gynecological examination is unremarkable. High vaginal and endocervical swabs are taken for microbiological testing, but results are awaited. What is the diagnosis? See, there are only 2 hints in the question, which will rule out many of the options. So there is vaginal discharge and unremarkable examination findings. So cervical ectropion, you will see there will be examination finding like pink mucosa, that is of endocervix is visible, and so that is ruled out. Cervical candidiasis, you will see plaques. So on bacterial vaginosis you don't see anything, and trichomoniasis you will see strawberry cervix. That's why the option is bacterial vaginosis. That's it for this video. If you want me to cover any of the topic, please let me know in the comment section. I will come up with the video soon. Thank you very much. All the best.